Hello everyone, welcome to our channel Study with Registered Nurse. Today I discuss the instrument part 2. At first I discuss about the flashing curette. The parts of the flashing curette. At first, proximal end with rubber tube attached, then handle, long hollow stem and spoon shaped scoop. Then I discuss about the uses of the flashing curette. At first, in suction evacuation, especially in old incomplete abortion, then placental polyp can be cured with the help of it. Then previously it was also used to flush the uterine cavity with the lukewarm antiseptic solution passing through the communicating channel. Then previously antiseptic solution was used to pass through the channel during the evacuation procedure. Then I discuss about the sterilization process. At first it was with the normal water, then soap water, then normal water. Then I dip the instrument in hypochlorite solution for 10 minutes, then clear in boiled water immediately to prevent the corrosive attachment. Then it placed with the surgical pack and exposed to steam under pressure in 120 degree temperature, 15 pound pressure for 30 minutes. Then I discuss about the Kocher hemostatic forceps. At first the parts: single tooth at distal end, inner surface of both jaw are serrated, মানে কি যে খাঁজ কাটা, falcum, catchlock and finger bow. Then I discuss its uses: grasping the heavy tissue of damping the large blood vessels to control the bleeding, clamping the umbilical cord after the delivery for better grip and effective crushing effect, using a clamp in hysterectomy operation, holding a vascular pedicus before cutting, then for artificial rupture of membrane, then for catching the edge of incision while suturing the skin. Then I discuss about the sterilization process. At first, dip the Kocher forceps in 5% hypochlorite solution for 10 minutes. Then it is to be cleaned with soap water, then running water. Then it should be placed in autoclave 20 to 30 minutes at 15 to 20 pound pressure and at a temperature of 21 degree Celsius to 125 degree Celsius. Then I discuss about the episiotomy scissor. At first, blunt blade, sharp blade, falcum, shaft and finger bow. Then I discuss its uses. During the second stage of labor, episiotomy scissors are used for cutting the perineum to enlarge the vaginal opening to deliver the fetal head. Then I discuss about the sterilization process. At first, it wash with detergent recommended by the manufacturer. After that, it wash with normal water, then soap water, then dip in 2% glutaraldehyde Sidex for 8 hours, then wash 3 times with sterile water. Then I discuss about the Pinard's fetoscope. It's have two parts: abdominal end and oral end. Then I discuss its uses: used to listen the fetal heart sound and used to obtain information about the fetal within uterus. Then I discuss its sterilization process. At first, wash with the detergent recommended by the manufacturer. After each use, it should be cleaned with sprit swab. Then I discuss about the cervical dilator. It has two parts: round tip and blunt tip. Then I discuss about the uses. At first, to dilate the cervix during the curating uterine contents in medical termination of pregnancy or incomplete abortion. Then to dilate the cervix to receive the spasmodic dysmenorrhea. Then to dilate the cervix before gynecological procedure cervical dilatation, reduce the risk of injury to the cervix during such as procedure. Then I discuss about the sterilization process. At first, wash with the normal water and detergent by recommended manufacturer, then wash with the normal water and then place with the surgical pack and expose with steam 120 degree temperature, 15 pound pressure for 30 minutes. Then I discuss about the multiple teeth valvulum forceps. At first I discuss about its part. First is sharp teeth, jaw, box lock, shaft, catch lock, finger bow. Then I discuss its uses. It is used to hold the anterior or posterior tip of the cervix in DE operation, suction evacuation. Then it is used to subtotal hysterectomy operation to hold the cervix and cut the vaginal wall around the cervix. Then to correct the mobile retroversion that cannot be corrected manually. To bring down the uterine fundus through an anterior or a posterior colostomy opening in vaginal hysterectomy. It has one disadvantage. What is this, sir? As it produces trauma to the soft vascular cervix. Then I discuss about the sterilization process. After used, wash in running water, then send for autoclave under pressure of 15 pound and 120 degree temperature for 30 minutes. Next instrument is Alice tissue forceps. At first I discuss its parts. At first, tip with sharp teeth, box lock, shaft, catch lock and finger bow. Then I discuss its uses. At first, to catch and hold the anterior tip of the cervix in DE operation, then to hold the apex of the episiotomy wound during the repair, then to catch or hold of the turn ends of the sphincter and extends prior to the suture in repair of complete perineal tear, then to catch the margin and angles of the uterine flap in LUCS after the delivery of baby as an alternative. Then I discuss its sterilization process. At first, the instrument is to be cleaned under the running water, then soap water, then running water. Then the instrument is dipped in 2% glutaraldehyde solution for 8 hours. Before use, wash 3 times with sterile water. Then autoclave is restricted as it is sharp instrument. মানে যেহেতু এটা শার্প তার জন্য এটাকে আমরা অটোক্লেভে পাঠাবো না। Then I discuss about the seams, blunt and sharp double-ended uterine curette. It has 3 parts: sharp smaller end, body and blunt larger end. Then I discuss its uses. At first, use in the operation of DC for incomplete abortion and to suction the uterine lining to diagnose or treat the abnormal bleeding. Then I discuss its sterilization process. At first, wash the instrument with running water, then soap water, then again running water. Then dip the instrument into 2% glutaraldehyde solution for 8 hours. After that, before use, wash it with sterile water 3 times. এটাও আমরা অটোক্লেভে পাঠাবো না, for it is a sharp instrument. Then I discuss about the artery forceps. The parts of artery forceps: at first, tip, jaw, box lock, shaft, ratchet lock and finger bow. Then I discuss its uses. At first, to stop the bleeding by catching the blood vessel, then to hold the incised ends of skin and fascia, then to enlarge the opening of the abscess in substitute of sinus forceps, then to hold the needle for suturing is a substitute for a needle holder. Then I discuss about the sterilization process. At first, clean with normal water, then soap water with friction, then again wash with the normal water and dip or soak into the glutaraldehyde for 2% 10 hours. or after clean artery forceps, dry properly, then send for autoclave. Then I discuss about the toothed dissecting forceps. It has 3 parts: tooth, jaw and shaft. Then I discuss its uses: to hold the skin margins during the suturing, then to hold the lines of alba on the rectus sheet during the closure of abdominal incision, to hold the scalp during the closure of scalp incision, then to lift the knot of suture while removing. Then I discuss its sterilization process: clear with the normal water, then soap water with friction, then again wash with the normal water, then dry it properly and send for autoclave at 115 to 20 IBS pressure for 20 to 30 minutes at 121 degree to 125 degree temperature. Then I discuss about the ovum holding forceps. It has fenestrated blade, jaw, fulcrum, shaft and finger bow. Then I discuss its uses. It used for to remove the product of conception in DE after its separation partially or completely. Then to remove the molar tissue in hydatiform mole, to remove the uterine polyp, then to remove any retent membrane. Then I discuss about the sterilization process. Dip in the instrument in 5% hypochlorite solution for 10 minutes. Then it is to be cleaned with soap and washed in running water. After that it should be sent for autoclave. তোমাদের কারোর যদি মনে হয় যে আমি পুরোটা বাংলায় বললে সুবিধা হয় তো প্লিজ কমেন্ট, আমি পুরোটা আবার বাংলায় করে ভিডিও বানাবো।